Hi folks, I'm Dr. Burke Mays. I'm a chiropractor practicing at Pathways Integrative Health. And today we're talking further about our ongoing series of why our thyroid doesn't work. You see, you get lots of patients coming in and they're dealing with the fatigue, the hair loss, the weight issues, the gut disturbances, the depression, all the issues that come with a poor thyroid function. And they've been into their doctor, they've had some lab work done, and they've been told the labs are fine. That's a whole other topic we'll do in a different video. But what happens is they don't look at what the underlying causes are of why the thyroid's not working the way they should be. And this topic on this video is one of the #1 causes of why the thyroid's not working well, and that is inflammation. Inflammation, when it's high, will shut down that whole process that makes your thyroid hormones. Now, thyroid hormones is what runs so many processes in your body. Literally every cell in your body has a receptor for a thyroid hormone, which means it needs to turn on activity to make your body work. So at a real basic level, we talk about the brain. The brain, we talk about the hypothalamus. The hypothalamus was packed with these receptors that sense the presence of the hormone called T4. T4 is the inactive form of the thyroid hormone, but your brain senses that if it's too low, it creates a messenger called thyroid releasing hormone. It goes down to your pituitary. We're still up in the brain, by the way. It goes down to the pituitary, and the pituitary releases a hormone called TSH. You've probably heard of that. That's one of the common markers that gets tested for thyroid health. That goes down, tells the thyroid to go to work to make your T4, which is the inactive form, and the T3, which is the active form. But this whole area up here, up in the brain, is densely packed with receptors for the chemistry of inflammation. And those chemicals are generally called cytokines. Cytokines, if they're high, tell us how bad inflammation is. When we talk about inflammation, we're talking about metabolic inflammation. Not like a local inflammation like when you injure a joint and that joint is swollen, but literally all your biochemical processes are inflamed. Your whole body's inflamed. And that, we're seeing in research, is one of the underlying causes to a whole host of health issues, from brain issues to depression to anxiety to digestive issues to allergies. Inflammation is a big underlying component. But at the level of the thyroid, cytokines, when they go up, indicate inflammation. Cytokines shut the brain down. And I don't commonly measure cytokines directly in this office because it's kind of an expensive test. But we can run common tests like an ESR or a homocysteine or a uric acid or a fibrinogen or a C-reactive protein. If those are up, that indicates that you're in an inflammatory state in your body. What causes inflammation? Lots of things. But a big one is food sensitivities. I mean, listen, the food that we have is not what it was 30, 40 years ago. It's been genetically modified, it's been processed, and our immune system recognizes it as something foreign. And the job of your immune system is to fight off foreign invaders, and inflammation is part of that fighting off process. Hidden infections, things like Epstein-Barr virus or herpes virus or Epstein-Barr virus or other infections like Lyme's disease, those all create inflammation when you have hidden infections. Diet. The American diet is super inflammatory. Processed fats, processed oils, missing the good oils, the good fats, missing the good nutrients that help combat inflammation. We really have a very inflammatory diet, and that causes a lot of issues. Autoimmune. Autoimmunity actually is the underlying cause to about 90% of thyroid disorders. That's where your immune system has gotten confused and it starts to attack your own body tissues. Thyroid gland can be one of them, but can attack any other body tissue. And lastly, blood sugar. Blood sugar is going up and down. Insulin goes up. Insulin's an inflammatory hormone, so that's going to be causing these receptors. That whole process is causing that part of the brain to shut down and not make the thyroid releasing hormone, not make the TSH, and your system starts creating the good thyroid hormones. So I hope this is informative for you. Hope you learned something from it, and thank you for watching.